Welcome to Organizing Life's Daily Demands. My name is Peter Gordon, and I'm the president of New York Financial Organizers. We help people pay their bills, file insurance claims, and generally help them with all the non-investment side of personal finance. And the purpose of this podcast is to introduce our audience to other people who help organize clients' life's daily demands. So today, I'm really excited to have Nancy Ruffner as our guest. She is a patient advocate working with adult children of aging parents, solo agers, elders, and patients themselves. So welcome, Nancy. How are you today?
Thank you. Very well. Very well.
That's good. I met Nancy at a conference, and she's a wonderful presenter, full of information, and I'm really looking forward to our conversation. Why don't you tell us a little bit about yourself? Give us your background.
Sure. I was an undergrad social worker that came out with her cape on, and it didn't take too long before I burned out in the classic social work arena. I went into other areas, always providing a service, always in the public eye, and eventually returned back to social work. When I was in the world of business, I was always missing providing a quality service. And so I came back to that. I did my graduate work some 30 years later, and that was counselor education, and began working with an employee assistance program, the benefits administrators for large companies. And then my parents started to change. They're a large part of my genesis into patient advocacy. As they did, we got to work. My sister and I thought we were the two best daughters on the planet to care for our folks. And we were, to a large degree, people started bringing their family problems and questions to me and telling me I should hang out my shingle. And the I could never, oh no, became a maybe, became a I will, and I did.
That's great. Yeah, it's not unusual for people who work with with elders to have started working for their parents or working with their parents, which is exactly what the genesis of my business was.
There you go.
So, and I think actually most daily money managers I know have had that experience.
Same with patient advocates. We've either had the family story, something that impacted our lives, changed the trajectory, or we were working on the inside of healthcare and didn't like or agree with what we saw and thought that we could help move the needle.
Yeah, and you do move the needle. That's the great thing about it. Yeah, and you mentioned something else about helping people and wanting to go from the corporate side to helping people. And being a social worker, we like to say that we're 50% bookkeeper and 50% social worker, and it's a big part of what we do. So, tell me, what do people need to know about the field of independent patient advocacy?
Well, you just picked up on the keyword, independent. It's a rather new field. We only came on the scene about 2009, and we were born out of the need for someone to journey with beyond a hospital setting. Many people may be familiar with the hospital patient advocates, and they do some good work, and they can get things done. But when you're discharged, they stay there, and you go where? And so in patient advocacy, we can journey, from home to hospital to rehab to back home, or maybe I got to find a new home. We can work with folks wherever they are. The other interesting thing about patient advocacy is it is a growing field, but we can niche, we can specialize also. I myself work with senior issues and strategy for solo aging. But there are many ways for patient advocates to serve. We are largely nurses and social workers in origin, and we remain largely so. But to the ranks, we have added attorneys, paralegals, advanced nurses, pharmacists, doctors, people who, again, are in a disagreement with healthcare as we see it and want to help people to navigate.
That's very interesting. So people outside of the health industry have become patient advocates?
There are a lot of people from insurance and pharmacy that have that have really found a home. And by home, not just a good place to set up shop, but they're answering a need. They're filling a need. They're providing answers.
Yeah, insurance, I know, is usually. Actually, I have a go-to person that I work with exactly that, and her background was in insurance, and she calls herself more a medical billing expert, but she's a patient advocate.
That's a very large niche within patient advocacy. They are busy. I myself can untangle a little bit of debacle, but I have my limits, and then I go to my go-to people.
Right. So when might an individual need a patient advocate?
During change. And sometimes that change is gradual and gosh, we need to plan, or sometimes it's fast change. And, things, my world just got turned upside down medically. I think that it's how to navigate our wacky healthcare system, or what's this new diagnosis and what does this mean to me and the people I love? How's this going to roll out? Sometimes it's how can we fix and what can we mitigate today? And other times the conversation is we need to play this all the way out. This particular diagnosis has a trajectory and we need to plan.
Right. And could you give me an example of something where somebody has come to that decision? They're like, well, I'm stuck, and I want to help my parents, or maybe it's the parent themselves, and they come to you. What's a typical scenario?
Well, I do a lot of work with Parkinson's patients, and while that disease remains hidden to them for many years, once we see the changes, and it's time to go to the doctor, it's time to get some testing done. It's time to receive the diagnosis, find out what that means to me and the people I love and how it's going to impact my life. Somebody may be falling. Somebody may experience the tremors that were so often associated with Parkinson's. And later on in the disease, a certain percentage of them experience dementia and hallucinations. And the interesting part is, they have hallucinations and they know that they're hallucinations. And so that alone is quite unsettling. And so we would need to plan, okay, my physical needs are going to change. And it's always with a patient advocate, we'll start with medical, but that quickly goes over into what I call the pie. It's a 6-piece pie. It'll be medical and then it'll be legal. Got to get my legal ducks in a row, review my documents, create new ones. Then it'll be financial. What's the caregiving pocketbook? How are we going to plan for now and later? And then insurance. Am I properly insured? Is it going to cover what I need to cover? Making careful decisions there. And then housing. Housing may change. Not everybody is safe to age at home. And a lot of times people will enter assisted living at some point. You got to plan for that. But there's a lot of education along the way. What is this product called assisted living? What is it? What are the boundaries? What is it like? How do I choose it? How do I tour?
How do you pay for it?
Yeah, the caregiving pocketbook. And then the support. What is my support going to be? And so, I've helped people with all pieces of the pie as they came forward. We made the short-term plan. We effected a long-term plan. We brought in the support, the things that were important to my client, Getting to his faith community was very important to him. Getting to his men's group on Tuesday morning was really important to him. Getting him to a Parkinson's Center of Excellence, which we were lucky enough to be within 30 miles of a really good center, which treated him holistically, and everything kind of dovetailed between what we were trying to plan.
That's wonderful.
Mm-hmm.
I've never heard of that.
There are centers for excellence located across the United States. Best way to find one is Parkinson's Center for Excellence. Google it, and you will be able to find that.
I need to write that down.
I think a lot of times, too, a big part of our job is bringing the family or the loved ones on the same page. So like you, we are part educator, part navigator, a little bit sometimes a conflict negotiator, but we're always in the patient's camp. We never make decisions for our patients. Our job is to provide them with the most information so that they can make the best decisions that are right for them and their unit, their family unit.
Yeah, no, and that's exactly what we say. We gather information, relevant information, and present it so people can make the best decisions themselves, whether by themselves or with their families.
Yeah.
So, and how do people locate independent patient advocates?
Well, we want you to, and we're working on becoming more visible. We have a lot of directories, search by zip code, search by need, directories within our professional organizations. We're still a young and unknown industry, so some of it's going to be word of mouth, but that we need to go larger, be loud and proud with our directories. And so we're all blogging, we're all speaking, we're all and thank you for opportunities like this because it helps spread the word. The best directory that I can provide for the folks that are viewing right now is Greater National Advocates or gnanow.org. I'll also hasten to say that you don't have to have your patient advocate right in your backyard. Now, there are times that boots on ground, seeing mom in the hospital, seeing dad in his environment, and how he functions in that environment is really important. But thank you. If anything good came out of the pandemic, it's our ability to work in telehealth fashion and to meet with people and coach them and coordinate care and interface with the other members of the medical and support teams online and get the job done. So if I'm not the best fit for the job, I do feel an obligation to take you where you need to be.
Right. That's wonderful. That's really wonderful. I know a lot of care managers. What's the difference between a patient advocate and a care manager?
I'm glad you asked that. That is a frequent question. A lot of care management enters into our job, or sometimes we're just dealing with the medical part and interfacing with the physicians and extended staff there, or trying to research clinical trials, or trying to get something pushed past your insurance. And sometimes we bring in a care manager to handle the day-to-day, the home care and the transportation and the other supports and getting dad to the Tuesday morning men's group. Other times we're the care manager. We have to feel a need to pilot this whole thing all the way through. But so if you're asking the question, what's the difference between patient advocate and care manager, and you're familiar with those Venn diagrams with the overlapping circles, there's a lot of overlap, and it's good overlap. This is not a we-they situation. It's a matter of finding the person or combination of persons that are the right fit.
Yeah, no, that's a great point. Sometimes there are daily money managers who overlap as care managers, and that's not a great fit from my experience. And we like to stay in our own lane. So I love working with care managers or patient advocates, or anybody who has an expertise that I don't have. And again, that's the point of doing this podcast.
And I thank you for saying that, because I feel like, we do all have something to offer. And we're kind of a three-legged stool. To me, it's patient advocate / care manager, the financial professional, and the legal professional. And you need all three legs.
Yeah, no, absolutely. And what is your particular niche? Who are your clients, and how do you help them?
Well, my niche has always been elder care, which puts me working with senior patients and the adult children of aging parents. A lot of times I'm hired by the adult children because mom or dad is changing. We need to get a handle on this. Or mom won't come to the table, but we see the handwriting on the wall that change is nigh. And if we're smart, we'll make some plans. We'll read that handwriting aloud and together. I work with solo agers. This is a particular niche for me. And that solo ager definition is persons who, by choice or circumstances, function without the support of built-in family as caregivers. And I do that because that's a growing niche. People are that
exponential.
Yeah, that population is being identified. A lot of people are self-identifying. I find it easy to work with solo agers because I am one. And so I do a lot of talking and teaching along those lines. I think it's important for folks to know, again, that we can work in telehealth fashion to assist you and provide the education that you need, the thought provocation. You don't have to do what I say, but I'm a kind of a have you thought of this kind of person. And okay, will this work with your family? Will this approach work with Aunt Susie? Oh, well, that one won't. I got 3 more I can run past you. A lot of times it's ways to, because we're having to get a reticent patient on board with what's going on. It's interesting. We're a lot of we untangle a lot of debacle, but we're running the weave all through the communication weave, the education about the medical aspects weave, the education about how we're going to pay for care, as you've mentioned. And so I find home in working with seniors and bringing hope to not only them, but to their adult children or the people that love them too. I find it especially challenging and rewarding when I can offer a complimentary consultation to someone to see if we're fit for services. And in those 20 minutes, I can assess what's going on, kind of what I call landscape the situation, and then provide hope. Here's a path. Here are or begin to prioritize all the stuff that's swarming around in their heads, which needs attention first, and what can we put on the back burner for a little bit. And people often tell me, I feel better right after that first short conversation. And that brings me a lot of satisfaction. Very proud.
Yeah, that's wonderful. Yeah, no, and a lot of attorneys reach out to us because they know solo agers who need somebody there to help them as they age financially,
Mm-hmm.
So, and then there's a natural extension that will happen as far as the healthcare is concerned.
Yeah.
You mentioned also about telehealth, which has been a great byproduct, if you can say anything great about the the COVID epidemic. But how do you find your clients their technical abilities, or they're willing to be receptive to telehealth?
Well, it's interesting. Folks have really come a long way on that. I remember when the pandemic first manifested and we're all on lockdown, I got to work in the education arena, and I and another lady named Nancy put together a couple of different webinar series, and we were covering here's how to prepare and execute your telehealth appointment, describing what it was going to be like,
Great.
familiarizing it. This is this may be just you're sitting in a waiting room. It's just an electronic waiting room, but you're still in that waiting room reading 10-year-old magazines. And, and then the doctor comes on and asks you questions. And sometimes I'm there with people when they're doing their telehealth. I'm frequently conferenced in, not only for medical appointments, but when someone's in housing situations like assisted living, and they'll have a plan of care meeting where they have, the facility director will be there, activities is there, billing office is usually there, nutrition, and we're staffing with the family and with the resident or patient, and kind of keeping our finger on the pulse of how things are, what needs tweaking, what do we need to plan for, are we entering the next stage of anything. But I'm conferenced in by video or phone on those all the time.
God. That's great. That's it's going to be developing as we speak. It's getting more and more positive, and I know you mentioned that because of technology, you can work. You don't have to be local, and
right.
Wonderful thing. Yeah. What's the best way for people to locate you, online or phone or?
Sure. I have a very robust website, and my social media is robust as well. My website is nancyruffner.com. My telephone number is 919-628-4428. I'm easily found on LinkedIn for the business slant, and I really roll on Facebook with a lot of healthcare patient advocacy trending. Here's what's going on. Here's how-tos and tips. It's Nancy Ruffner, patient advocate, aging expert, or whatever I'm going by. But you can find me on Facebook with using Nancy Ruffner. Another good way for folks to learn more about me is to join my online community. And this is really cool. Every other week, I will send an email to your inbox, and inside that email is going to be a video will be embedded, and I do a little teaching segment in that. It also, in that email, will have a link over to where you can consume with by audio or by reading a traditional reading of the blog. And so consume where and when and how you wish, but I'd love for folks to contact me. My email, and I read them all, is nancy@nancyruffner.com. And if you'd like to join my email community, I'd love to send you those segments and just, develop a relationship. So I'll be there. If anything ever happens to you, and then you can say, I know somebody, that's what I'm after.
That's so important. That's so important. And I know you, there's a plethora of information that you put out there, and it's so wonderful. And you're a great educator. And,
thank you.
All that information that you just gave is also going to be on the podcast screen, on the podcast page, as well as if you're watching the video, it'll all be there right from the start. So, Nancy, I can't thank you enough. This was a wonderful, animated conversation, as I knew it would be from the first time I met you. I love your enthusiasm, and I know you're a wonderful professional. So, thank you very much.
And I thank you.
Okay, and that's it, everybody. I hope to see you at my next video, and/or for you to hear us at the next podcast. Take care now.